Welcome to the deep dive. Today we're digging into something pretty amazing. Your body's own defense systems. The intricate ways it protects us day in, day out.
It really is incredible.
And what's maybe even more fascinating is how science has figured out how to, amplify those defenses, not replace them.
Exactly. Giving them a boost.
So this deep dive is all about biologicals. We're talking about things like vaccines and immune sera, really fundamental medical tools, but maybe not always fully understood.
That sounds about right. Lots of confusion sometimes.
Our mission here is really to give you a clear, kind of concise understanding. How do these things work? How are they different? And what's their real impact on our health and safety? Hopefully we'll hit some aha moments and maybe cover some surprising uses too.
Sounds good. And to really get biologicals, we probably need to start with the basics of immunity itself, right? How our body fights things off.
Good point. Let's lay that foundation. Two main types, I gather.
Yep, two fundamental ways.
Okay, let's start with active immunity. How does our body pull that off?
Active immunity is, it's your body learning, essentially. When it sees a foreign protein, maybe from a virus, maybe bacteria, it flags it. And then it actually makes its own antibodies designed specifically for that threat.
Ah, so it's building its own defense library, kind of?
Exactly. It's creating a memory, its own personalized defense force. It's designed to last.
Okay. And the other type is passive immunity? Sounds different.
It is quite different, yeah. Passive immunity is more immediate but temporary. It's when you get antibodies that are already made. Someone else or something else made them.
So not made by your own body?
Correct. It can happen artificially, like through an injection, that's passive artificial immunity. Or it happens naturally, like when antibodies pass from mother to baby during pregnancy or breastfeeding. That gives the baby protection right away. Borrowed protection, essentially.
Borrowed protection. I like that. Okay, that distinction feels really key. Active is learning, passive is borrowing.
You got it.
So with that in mind, let's zoom in on vaccines. When we say immunization, what's the core idea?
Immunization is basically how we artificially kickstart that active immunity we just talked about.
Okay.
The main goal is to show the body something specific, like a weakened virus, or maybe just a piece of it, something less toxic so the immune system learns to recognize it and builds defenses. But, crucially, without you actually getting sick with the full disease.
So it's a safe way to teach the immune system.
Precisely. It's a controlled introduction.
And the effect this has had on public health is just massive, isn't it?
Oh, absolutely monumental. Think about diseases that used to be devastating, polio, measles, things like that. Routine childhood immunizations have made them rare in many parts of the world.
And the CDC keeps updating recommendations.
Right.
Based on new info.
Exactly. They publish schedules every year, and these aren't set in stone. They change based on, experience, what diseases are circulating, new scientific developments.
But it's not just about the science working, is it? There are real-world challenges.
You're right. Implementation is complex. Vaccine cost, for example, can be a really significant hurdle for families. It's a public health win that doesn't always reach everyone easily.
That's a tough reality.
It is. And that's where healthcare folks, especially nurses, are so important. Educating people, talking about safety, effectiveness, helping navigate access. It's vital work.
Absolutely. So therapeutically, vaccines stimulate active immunity for people at risk. The specific one depends on the threat. But the big promise, the really powerful idea, is that vaccines are thought to provide lifelong immunity. How realistic is that?
That's the goal, leveraging those memory cells we talked about with active immunity. Once your immune system learns from the vaccine, those memory cells stick around. If the real germ shows up later, bam, they recognize it and launch a fast defense. Often, this protection does last a very, very long time, sometimes life.
It's an incredible long-term strategy.
It really is. But like with any medical intervention, it's not for everyone in every situation. There are times when vaccines aren't recommended. We call these contraindications.
All right. Can you walk us through some of those and maybe the why behind them?
Sure. So a big one is if someone has a severe immune deficiency, their immune system just can't respond properly to build those antibodies.
So the vaccine wouldn't work.
It might not work well, and with live vaccines, the ones using a weakened but still living virus, it could actually be dangerous. The weakened virus might cause illness in someone severely immunocompromised.
Okay, that makes sense. What else?
Well, live vaccines are generally avoided during pregnancy. It's mostly a precaution, a theoretical risk that the weakened virus could affect the fetus.
Got it. Precautionary.
Yeah. And of course, if you've had a known severe allergic reaction to a vaccine component before, you shouldn't get it again. Pretty straightforward.
Makes sense.
Also, there's a timing thing. If you've recently received immune globulin, those pre-made antibodies we mentioned, or other blood products, vaccination might be delayed.
What is that?
Because those borrowed antibodies floating around can actually interfere with your body's ability to respond properly to the vaccine and make its own long-lasting immunity.
Ah, interesting. So the borrowed antibodies get in the way of the learning process.
Sort of, yeah. Temporarily.
Okay. And then sometimes it's not a hard no, but more like proceed with caution.
Exactly. Situations where you need to weigh the risks and benefits carefully. For example, someone with a history of febrile convulsions, seizures brought on by fever.
Right.
Since vaccines can sometimes cause a mild fever as the immune system ramps up, you'd want to be cautious. Same for someone with a past brain injury or any condition where a high fever could be risky.
Or if someone's already sick.
Yeah, if they have an acute infection, their body's already fighting something off. Adding a vaccine might be too much or might not work as well. Best to wait until they recover.
Okay. Let's talk about side effects. Most people know about the sore arm, maybe feeling a bit off.
Right, the common stuff. Mild fever, maybe a rash, feeling tired or achy, chills. Sometimes kids get fretful or lose their appetite, maybe some vomiting. And yeah, definitely local reactions, pain, redness, swelling right where you got the shot. Sometimes a little hard knot can form there too.
Well, sounds pretty manageable.
Generally, yes. It usually means your immune system is kicking into gear, which is what you want. But, and this is important for you to note, there are rare side effects that can be severe. Things like serious allergic reactions, hypersensitivity, or even effects on the central nervous system. Very uncommon, but possible.
That brings up interactions. Can other drugs mess with how vaccines work?
Oh, definitely. Drug interactions are a big consideration. The classic example is immunosuppressant drugs.
The ones that dial down the immune system.
Exactly. If you're taking those, a vaccine might not be very effective. Why? Because the drugs are suppressing the very immune response the vaccine needs to trigger.
So the body can't learn properly.
Right. It can't build those antibodies efficiently. And again, with a live vaccine, it's even riskier. That weakened virus could potentially cause a real infection if your immune system is tamped down too much.
Wow. Okay. So there's a lot of precision involved in using vaccines safely and effectively.
Absolutely.
And it's not just about common illnesses. Vaccines play a role in something much scarier, too. Biological weapons. How do they fit in there?
Yeah, it's a sobering but important application. It shows how medicine adapts to protect populations against deliberate threats, not just natural ones.
So we have specific vaccines for those kinds of threats.
We do, or some are in development. They're often stockpiled or given to high-risk groups, like the military. For anthrax, for example, there's a vaccine used both preventatively and after exposure in an emergency. That shows a layered defense strategy. The smallpox vaccine is given to some military folks and other high-risk people. For tularemia, there's an investigational vaccine, but drugs are also key after exposure. There's a botulism toxoid available through the CDC for specific groups. And more recently, for viral hemorrhagic fever, there's now an FDA-approved vaccine for Ebola.
Wow.
These aren't just medicines, they're strategic defense assets in those contexts.
That's a whole other level of application. Okay, incredibly important. Now, let's shift gears. Let's talk about the other category. Immune sera. This is where that distinction you made earlier really comes into play, right?
Exactly. This is the flip side. Remember how vaccines teach your body to make antibodies?
Yeah, the active immunity, the learning.
Right. Well, immune sera are different. They contain the antibodies already made, preformed. You're getting them directly.
Ah, so this is the passive artificial immunity, the borrowed help.
Precisely. It's like getting an instant security detail rather than training your own. Immediate but temporary protection.
So what kind of threats can these preformed antibodies target?
They can be pretty specific. We have immune sera with antibodies against various things, bacterial toxins, venoms from snakes or spiders, certain viruses, bacteria themselves, even specific factors on red blood cells.
So there are different types, like antitoxin?
Yep. Antitoxins have antibodies specifically aimed at toxins released by bacteria like tetanus or diphtheria toxins. And then there's antivenin, which is the term for immune sera containing antibodies against venom, like from a snake bite or a black widow spider bite.
Okay. So how are they used therapeutically? When would you reach for immune sera instead of a vaccine?
Their main job is to provide that immediate passive immunity when someone's been exposed to something specific, like a toxin or venom, or maybe a disease they have no immunity to.
For immediate danger.
Right. Or they can be used as prophylaxis, meaning prevention, after an exposure, especially in someone who is immunosuppressed and can't make their own antibodies quickly or effectively. Think maybe exposure to rabies or hepatitis B in certain situations. They can also help lessen the severity of a disease if given soon after you know or suspect you've been exposed. One thing to note is we don't have the same kind of detailed pharmacokinetic data how the body processes them as we do for many drugs because their action is so direct and immediate.
Interesting. And like vaccines, are there contraindications? Times you definitely shouldn't use them?
The main one is pretty clear. If you've had a severe allergic reaction to that specific immune sera or maybe a similar product in the past, that's a major red flag.
Okay. And any situations needing extra caution?
Yes, definitely. Caution is advised during pregnancy. Also, if someone has bleeding issues like coagulation defects or thrombocytopenia, which is low platelets because these are often given by injection, sometimes intramuscularly.
The injection risk.
Right. And also, if someone has received that same immune sera before, you need to be cautious because the risk of an allergic reaction might be higher the second time around.
Okay. What about adverse effects for immune sera?
Well, you're introducing foreign proteins, essentially, so you can get reactions related to the immune system responding to that. Things like a rash, nausea, vomiting, chills, fever.
So similar to some vaccine reactions.
Somewhat, yes. But you can also get more significant allergic reactions, chest tightness, blood pressure dropping, trouble breathing. That's serious. And like vaccines, you can get local site reactions, swelling, tenderness, pain, maybe muscle stiffness where the shot was given.
And finally, drug interactions.
Yes.
Same issue as with vaccines.
Yes, the interaction with immunosuppressant drugs is, again, a key one to be aware of. Those drugs can potentially interfere with how the immune sera works or affect the overall immune response.
It's really striking when you lay it out like this. Vaccines teaching the body for the long haul. Immune sera providing immediate, direct help.
Exactly. Two sides of the same coin, in a way, managing immune responses.
Both are such precise tools, just fundamentally changing how we deal with diseases, whether it's building that lifelong memory or getting that instant defense boost.
They really are pillars of modern medicine. Different tools for different jobs, but both vital.
So, thinking about all this, how does understanding these mechanisms, this difference between teaching your body and giving it direct aid, change how you view preventative health versus emergency interventions?
That's a great question to ponder. It highlights the different strategies we have, and it makes you think, what does it really mean to outsmart a pathogen? Sometimes it's training your body years in advance. Sometimes it's deploying immediate reinforcements. Both are pretty sophisticated ways we interact with the microscopic world around us, trying to stay one step ahead.